Namaskar and welcome to Exploring the Gold Mine.
Namaskar.
So, as you can see, we have Dr. Sudarshan Singh with us today. Dr. Sudarshan Singh is a physiotherapist, um, but there's something different about him. I have come across a lot of physiotherapists, but the difference between him and maybe many other people is that he focuses a lot on body alignment. And his way of treating people is by focusing on body alignment, and this is like a little different from many other things which we experience as patients. Uh, we will talk about all of these, about what body alignment is, how it helps, and what are the benefits, and all of that. But that's not enough. Dr. Sudarshan, being a doctor and probably being a physiotherapist, he is a fitness enthusiast. So we will see one of his videos to understand what he does. And uh, he has many celebrities who are also his clients, along with a huge followers on Instagram. Some of them being athlete Akshay Khote, um, actress Sonali Joshi, actor Rahul Sharma, and many CEO of hospitals and companies too are Dr. Sudarshan's client. Welcome to the show, Dr. Sudarshan. It's a pleasure to have you on the show.
Thank you, Dr. Vandana. Thank you so much for inviting me. It's a privilege for me to be here.
Okay, so before asking you what is body alignment and things like that, I want to play a small video for the viewers so that they get to know what am I talking about. So let's have a look at this video first.
Breathe, breathe out. Okay,
I'm scared of this one.
breathe, breathe out. No movement from you. No assistance, no resistance. Okay, no movement from
Yeah.
you. Breathe, breathe out. Awesome. सांस लो बाहर breathe out. Good. Breathe out. Awesome. Breathe. Breathe out.
Wow. So tell us something about, first of all, body alignment. What is that body alignment you keep talking about all the time?
Body alignment is nothing but the way we have compensated with injuries and how presently our body is, for example, the moment you have an injury, whether it is a knee injury or a back problem, a lot of people do have issues when they say that, they had a disc injury 5 years back, they had an issue 10 years back. So it doesn't mean that once now you don't have the symptoms, it means that you're completely healed. There is some sort of
Okay.
compensation there is some sort of compensation that the body has taken, and it has actually adjusted itself to that particular injury, because of which now your body has actually started compensating. So different issues, like you will see, sometimes people having one leg a little shorter than the other one because their weight bearing pattern has changed completely over a period of time. That's only because the pelvis alignment changes. The pelvis is not balanced. It is one up, and the other one is down. Now, because of this, you will see one leg is bigger than the other one. A lot of bodybuilders who come to me have issues related to the upper body, where the scapula, the bone which you have, the flat bone which you have on the backside, that is like,
Okay.
one of them is above, the other one is a little below, and the overall appearance is very different. And the reason is that somewhere the injury has not been taken care of properly, or probably there is something missing out in their training. Because of this, your body gets into a wrong kind of posture and loses its alignment. And that's what is body alignment all about. When we do these sessions, we try to get these things in place again. Okay. Now, it doesn't mean that, you have to have an injury for that. Probably you might have already had an injury before. So when you undergo this kind of session with me, it actually starts creating these changes in your body.
Okay. So, what are the benefits of doing a session with you? So, how is it that you help me in the healing or the recovery process?
So basically, the only reason that people will come to us is pain or it
Right.
is limited mobility. Okay. When we
Okay.
do a body alignment, all we are doing is trying to ensure to get the maximum amount of range of motion for any part of the body. That could be your shoulder, that
Okay.
could be your knee, that could be your spine as such. So what we are trying to do is, improve the range of motion. That is one thing. And secondly, it has shown through research that with these kind of movements, which are very natural movements, for example, you may be cracking your fingers every day. What is the reason behind that? So when you do that, you feel a ease of movement. Okay. Now this
Correct.
ease of movement cannot happen for your whole body, or you cannot do that on your own for your whole body. So this is what we are doing in some manner. At the same time, we are also trying to ensure that your range of motion is maintained or improved further. Because most of the time, your complaint is either pain or it is limited range. Now, both this is a very vicious cycle, okay? And you have to break the cycle somewhere. So once your body alignment session is done, a lot of patients see that immediately there is a good amount of range of motion, and because they can move their arms or because they can move their body, it seems to be easy, and obviously the pain is felt much lesser. And research has also shown that it has a very good effect on the pain system. So it definitely helps to
Okay.
reduce the overall pain.
Hmm. Okay. So,
And help us understand that would a patient come to you?
I couldn't
Would
hear you.
I mean
I
he
just
has a
missed this
problem,
one.
he comes to you, or he is recommended by some doctor to visit you, and then they come to you. As in, if I have a
Well,
problem,
I
how do
think
I reach you?
nowadays, yeah. So nowadays, I think there is a lot of awareness among people where they understand that, these things can
Can you
actually
hear
be
me?
managed. Okay, I guess Dr. Vandana has gone out for a technical error. She should be back anytime. But just to answer her question, um, well, actually, a lot of patients today already have a good amount of awareness. They do understand that physiotherapy is so important, and a lot of issues can
Maybe
actually be treated
something went
only.
wrong with me because of the
Yeah,
new Bluetooth, earpods which I was using.
no worries. I
So
was I
yeah,
was just asking, answering your question.
yeah. So
Okay,
my question
so
was,
yes, go ahead.
yeah, tell me. So let's continue where we left,
Yeah,
as in,
yeah.
um, how do a person reach you?
So basically, like I was putting this up, most of the people today are aware of physiotherapy. They understand the importance of a physiotherapist and what role a physiotherapist has to play when it comes to joint mobility, when it comes to reducing the pain, reducing the range of motion. At the same time, the kind of activities that I am doing, it only helps to give a much practical approach to physiotherapy once again. And most of the patients who come to me, they beforehand, what they would tell me is that we don't want medicines. I hope you're not giving us medicines. And that is where I'm very clear that no, we don't give medicines. All we do
No.
is we help you to improve your range of motion. At the same time, also give some exercises to ensure that your
Okay.
body is moving and it is in a good mobile state.
Okay. So now the next question is that how long would a session take? I mean, basically, if a person wants to come to you, how many minimum number of session A he should take to see some result, and how long is one session basically?
So basically, the first session is something which takes a little longer because we need to do some assessments, we need to do some understanding of the body, understand where what is wrong, and accordingly consider doing the manipulations. How much time does it take? Well, in the session itself, a lot of patients do feel the relief, but normally, depending upon the problem, it takes about 4 to 5 sessions to get to a good kind of result. Okay, but having said that, age group of about, let's say, 20 to 30, 35 uh, can actually see this difference in just 2 sessions, even 2 sessions are good enough for them. But if you talk about people who are 50 plus, having knee issues, shoulder issues, or severe shoulder problems, they tend to take about 3 to 4 sessions and followed by the proper exercise form also. That's very important because if they've been following the proper exercise protocol, because just spinal manipulation or getting into the body alignment is not the complete solution. And this is what I keep telling my patients, that you need to work on the exercise aspect and ensure that it is done in the right way. So yeah, about 4 to 5 session gives a good difference.
Okay, so the jerks which I can see in the video,
Yeah.
they look like really painful and like scary. So are they painful? Is what I want to ask you.
It's not painful. Most of the time, what I have seen is patients. There is definitely a amount of pressure. Okay, but most of the time, what I have seen is that patients feel a great amount of relief once the movement is done. So it's not really painful, but I would say there is a minimal amount of pressure in a certain area, and all these movements are absolutely natural. Like, all we are doing is we are only taking this movement to the end range of motion or to the maximum amount of movement available, and we are just cracking it there. So it's a very natural kind of movement. I'm not doing anything abnormal because a lot of people do tell me that your neck videos are very scary. It looks as if you're going to twist a neck, and this is how soldiers do it when they have to kill each other. But that is a different movement altogether. And what I do is a completely different movement altogether. So this is a very natural and a trained kind of movement. And all you feel is a great amount of relief once this movement is done completely.
Yeah, but after looking at the video, I would be like really scared too.
Yeah, I think you should also look at the reactions once you see the video.
Yeah,
You should also keep looking.
yeah,
Yeah,
yeah.
yeah. So I think
I
I
saw
think if
the
you see
patients are like
yeah,
not reacting at all or making some kind of painful sound or something. So I was
yeah.
also a little curious to understand how and what is happening.
It's just a pressure
Okay,
and there is zero pain.
that's lovely.
Yeah.
But other thing is that I also want to understand: is it only effective on some injury that has happened recently, or it is also effective in old prolonged pain? Maybe 10-year-old pain or a 15-year-old pain. I don't know if that's effective there.
Like I told you that any injury in the past is going to create a compensation to your body. Okay, and if it has not healed properly, or if it has not got the right kind of direction to heal properly, body will manifest itself with that compensation and start living. So whether it is an old injury or a new injury, definitely these movements will give results. And it's not like, I've seen people who have breathing issues, and when we do a complete thoracic spinal manipulation for them, where we just not only crack the thoracic spine but also the rib cage area by mobilizing the rib cage. Well, that has shown some drastic results, and it has just opened up. Like they're like, we have not been able to breathe this well before. So that's the kind of changes that I have seen when it comes to even chronic injuries. So yes, it definitely works in acute as well as chronic injuries.
Okay, so is it also effective in sports injury?
Yeah, I see a lot of athletes because a lot of athletes undergo, issues which are related to muscle imbalances, and there can be issues where the training may go wrong, or probably they are training with the wrong kind of posture or the wrong kind of form. So this body alignment definitely helps for athletes, runners, cyclists, and even bodybuilders to, kind of have the right form. Like I had a patient who was like a bodybuilder, and he at one point of time actually gave up on bodybuilding because he had shoulder issues where, he had a little bit of niggle always in the shoulder, and there was a
Okay.
scapular issue where one scapula was a little higher than the other. So after doing about 2 or 3 sessions, and when he started continuing with his training program again, today he's actually preparing himself for a body show because he's doing really well, and he's pumped up back again, and he's in a better form than what he was before. So it definitely works very well for athletes.
That's wonderful. And
Yeah.
what pain like, see, I understand it's very effective for kind of spine and maybe, kind of cervical kind of thing. I
Yeah.
don't know.
Yeah.
That's how I perceive it. But is it
Yeah.
also effective joint pains, like, an elbow pain or a knee pain? Is it also effective in that kind of pains?
So, more of weight-bearing areas like knee pain or hip
Yeah.
pain can definitely settle down or can definitely have a very good effect when it comes to body
Okay.
alignment. But talking about
Hmm.
more of a localized pain, which is in the elbow area or probably on a finger area, these are more like inflammation, and these are more like repetitive strain related pains. These injuries
Correct.
normally happen when, you are overdoing that particular activity, though you may not be
Absolutely
doing a
right.
weight bearing. Yeah. Though you may not be doing a weight bearing like knee or hip, but still, even lifting a mug of water or probably a bottle of water may be a little painful. So in this case, we also share some exercises which actually helps them to, because it is nothing but a imbalance of
Uh, Dr. Sudarshan, I don't know, I'm finding it difficult to hear you. Can you hear me? Are you able to hear me? I don't know if the problem is in my end. Uh, Viewers, can you hear the guest, please? Yeah, please go ahead and let me see if I can.
yeah.
Yes, Dr.
You can hear me?
Sudarshan, can. Yeah, please. Yeah, I can hear you now.
Okay.
Yes.
So what was I talking about?
Yeah, so it's basically, inflammation, when we're talking about joints,
Yeah, we're talking about
so
tennis
it's due
elbow.
to
So
repetitive.
it's more of a local injury, and these local injuries normally what happens is that basically there is an imbalance of the muscle length, and what we advise them is a good amount of activity related to stretching the flexors, stretching the extensors. Basically, the wrist is a little tight, and elbow joint normally has only one point from which you will have all the muscles coming in, and so we just teach a few exercises here, but spinal manipulation doesn't have a lot of role to play when it comes to localized or specific injuries, which are more of, like tennis elbow.
Okay. So,
Yeah,
also want to talk very short about tennis elbow. Tennis
yeah,
elbow, which is most common with people who play maybe badminton or who play some kind of sports, or
yeah.
normally people get tennis elbow. So, what about tennis
Yes,
elbow?
yes,
Is it
absolutely. So
you have
basically,
that
it's just a overuse of the muscles, and
right?
a certain direction in which you're working. Tennis elbow is very common in housewives also, though they may not be playing tennis at any point of time. But so the
Absolutely.
reason is only overuse. It's just that,
Okay.
certain kind of activity which is repeated over a period of time. So let's say a new person who's just got introduced to a game and he started playing badminton or tennis can also have this kind of pain. At the same
Yes,
time,
Dr. Sudarshan. See, actually, I thought of taking
yeah,
this opportunity because, I have a doctor in front of me, and see, I started playing badminton about 2, 3 months back in the lockdown.
yeah,
Then
yeah, yeah,
I
yeah,
developed a tennis elbow.
yeah,
So,
yeah,
so
yeah.
what should a person like me do basically?
So
Like,
see,
as in, we
I
should
think
stop playing the game, or what we
no,
should do?
no, that's not the solution. I think what we need to understand is that we just have to be a little fair to our body. Okay. Whenever you try to do a certain kind of activity, let's say when you're trying to play a game, Um,
Right.
we always feel that playing a game will bring fitness to us without realizing that how fit are you to play the game. Okay, most of the athletes or
Okay.
most of the people that you see, they first take care of their fitness, okay, and then they try to ensure that they can play the game. So today,
Okay.
fitness is more important than playing a particular game because it will only help you to make it all the more better. Now, whenever, let's say, even if you're playing badminton, all you could do is start with some very basic exercises for your shoulders and your elbows just to ensure that you develop a good tone. Okay, because let's say if you are not exercising, or if you're not doing into any, or if you're not into any sort of fitness, you're probably a housewife and now you want to start playing badminton. So basically, your physical activity remains the same. By playing badminton, you're adding a good amount of physical activity to your body, and this physical activity is the same because your actions, your game, more or less is the same. So what happens is that this is where you start doing an overuse of your elbow joint or your shoulder joint, and
Right.
invite injury. Okay. So all you need to do is, if you understand that you are going to take a little more effort from shoulder, you are going to take a little more effort from elbow. So probably just train it. Do a little bit of stretching, do a little bit of strengthening, do a little bit of icing when you see that your muscles are getting sore. Because initially, when
Right.
these soreness happen, normally patients feel that, oh, this is very normal. Probably this is because I have played. But yes,
Absolutely. These are like
there is
simple
a way to
cramps,
recover.
that's
Yes,
correct.
yes.
Correct.
But
Yeah.
then there is a
Right.
way to recover. Okay. And
Mhm.
normally, as if we are not into a professional guidance, what we do is we just assume that, okay, maybe it's for 24 hours, and if I just take 2 days and then again I go and play, I'll be absolutely fine. You can simply,
Correct.
what you can do is do some icing to it, and you will feel the muscle recovers better. If you do a little bit of
Okay.
stretching, you can also see that things can get better. So this is all what happens in a professional guidance. And human
Okay.
body is not different. Like, you also have the same kind of muscles, and athlete would also have the same kind of muscles. And when you are
Right.
taking that effort, obviously that response has to come to you. So all I'm saying is you got to be a little fair to your body. And
Mhm.
when you want to play a game, just make sure that you are fit enough or your joints are fit enough in order to play a game.
So, what you do basically helps people to recover completely. I mean, as in heal completely, or that's only a temporary relief.
So, Dr. Vandana, like, I'm sure you understand that there is nothing called a complete recovery. Okay. Or even if I have to say, it's more like something in your mind. How do you take your problem? Okay. Because
Absolutely.
uh, a lot of times this has also been taught to us in our schools, and we have seen this happening that a patient, 50% of the problem is in his mind. Okay. As
Absolutely.
a doctor, we only treat 50% of the problem. Okay.
Right.
Now, the rest of the 50% is when what he thinks about it, how he thinks about it. Let's say if I have been able to reduce the pain to 10%, from 100%, if I've been able to reduce the pain to 10%, and if the patient would say that, I still feel that I'm only 40% better, 60% pain of still there is still there. That's because psychologically he has never accepted this recovery. So even if there is a 10% pain
Correct.
left, he still feels that this 10% pain should also go off completely. So I would not say
Okay.
that, this is the kind of recovery expected. Having said that, we also understand there is nothing permanent in life. Okay, as you
Absolutely.
grow, your body is degenerating on a daily basis. If you're not exercising,
Absolutely.
it is degenerating further. So when we have an injury, all we expect is the doctor is supposed to do everything right. What I would like to tell you is that whether you take medicines or any other form of painkillers, it only modifies your problem. It only makes you
Correct.
forget the pain for some time. It doesn't cure your problem. Okay. Well, with
Correct.
exercise, with body alignment, with physiotherapy, you definitely are reversing this whole cycle. You are actually trying to uh, heal your body in a more natural way. And as a physiotherapist is basically only trying to push this whole recovery and ensure that this becomes all the more better. So if you follow this whole protocol, definitely recovery is complete. But most of the
Hmm.
time, the expectation is a lot which matters. What
Immense.
people
Yeah.
expect from a therapy is something what really matters. Because I've seen a lot of people who have undergone surgeries and they are still not happy, because only because sometimes there is a miscommunication between the surgeon and the patient, where the surgeon is not, where the patient expects that everything will be fine after the surgery, and the surgeon
Right.
very well
Right.
knows that. Yes, and the surgeon very well knows that
Yes.
we are only treating certain areas, but yes, a few problems will always be there. Now, if the patient
Absolutely.
feels that, oh, if I've done a surgery, but I'm still 100% not completely better, there is a rehab process to be followed. There are certain things that have to be followed by protocol. If all of this happens, you will definitely feel 100% recovery. But it's not just the surgeon's job, it is the whole team that has to work. At the same time, it is the patient that has to work. So that's how, recovery has to be defined.
Recovery happens. Yes, I understand. And
Yes, absolutely.
moreover,
Absolutely.
when we are getting operated, actually, what you said is absolutely right. And I believe in that, that operation should be the last resort one should
Yes.
go to. If
Yes.
there is a recovery that can happen through physiotherapy or through medicines, then people, my
Absolutely.
personal opinion, yeah, and operation, because sometimes I have seen, I know some people who just think that no, let me not take the hard way, because exercising daily, going for a physiotherapy, these or doing a yoga daily is sometimes a very hard way to do. So people think that let me get operated once and all my problems will be sorted out together. But
Well,
unfortunately,
this
that
is
never
where
happens.
this is where this is where people don't realize that even if I'm asking a patient to undergo any sort of exercise, it's more than a
Correct.
therapy, it's what the body needs. You know,
Absolutely.
more than my exercise, it is something that your body is required to do. So it's like brushing your teeth every day. It's like eating every day. If you can do this,
Correct.
you might as well exercise every day. This is how we place the importance for movement and for exercise.
Right. So what is the age group of people mostly coming to you? Because I have noticed mostly young people only coming to you. So do you have
So,
older clients, and can
oh
older
yes,
clients, sorry,
yes,
yeah, it can they be treated?
absolutely, absolutely. Oh yes, I
Okay.
mean, I have done a body alignment for a 80-year-old patient, and we have his
Oh
complete
God.
video, yeah, on
Okay.
Instagram. And we
Okay.
even have a follow-up video when he came back after 2 weeks, and he was much better, because people at this age
Okay.
do show good results, because if they have never undergone a body alignment session, those movements will certainly help them to
Okay.
get a little more mobile. But yes, if I talk about the age group, I would say 80 to 90% of recovery or movement can be felt by the age group between 20 to 50. They would feel a maximum amount of recovery. So when I compare it, yes, young patients will feel this, because they have more issues related to work from home. They have bad postures, and if we really compare people who have been living in the last 3 to 4 decades, we have seen that movement has become lesser, lesser, lesser on a daily basis. Initially, people had to
Correct.
travel. They used to travel by local transport, so there was a little bit of walking. There was a little bit of
Walking.
moving
Yeah.
around.
Correct.
Yes, all this has just taken a complete toll. Besides that, you could see now everybody is in their car. They want to have their car just at the entrance of their house. At the same time, when they reach office, it is exactly placed just near the office. There's hardly any movement happening. And work from home today has become a huge disguise. I have seen so many patients in this corona time, the last 2 years, where people have complained of neck pain, shoulder pain, and it's only because of work from home, because the
Okay.
ergonomics has not been in place. They have not been sitting properly, they have not been taking proper breaks, because of which these issues have happened. So, yeah, and this is the lot I think which is working today, the 20 to 55. And eventually, if they don't look at it, eventually this results to headaches, this results to migraine and more severe issues, and it takes a complete toll on their health. So I think this is the group, yes, that has benefited the most. I mean, what even the most of the patients that I see, or even kind
Yeah.
of we have seen, yeah, they have benefited in a huge way. And I think that what we do is that we don't just do body alignment, but we also push a lot on the culture of movement, on the culture of exercise. We actually help them understand that your movement is for your body. It's not my therapy. Okay. This movement will actually help to improve your body. So don't just take it as a medicine or a therapy. Think about it and see it as a movement which is required for your own body. And a lot of luckily I have seen that a lot of patients have actually started realizing that they have started being a little better in their posture. They have started realizing the importance of movement. When I say movement, it is not just about gym, that go and join a gym or do your activity for an hour. It
Right.
is not just about 1 hour of activity. Even 20 minutes of activity, whether it is done in the morning or it is done in the evening, even that can be very helpful when it comes to mobility, when it comes to keeping the body mobile, because ultimately human body is meant to be more mobile rather than
Yeah.
just using mobile.
Right. Correct. I loved your last thing which you said. Yeah, it's meant to be more mobile than just using mobile. And
Yes,
we're
absolutely.
discussing about people in age group of 20 to 55. But the sad part is that even small children today are so used to mobile
Yes.
and
Yes.
doing more of mobile activity than doing you know physical activities, and it's really really difficult to control their
Yes.
screen time. So basically, what I understand, Dr. Sudarshan, is that the main reason why we might get, you know, I'm not talking about injuries, but sometimes we develop pain in some parts of the body, could be due to less mobility, wrong body postures. These are the two
Yes.
things which I could understand
Absolutely.
from our discussion
Absolutely.
today.
Absolutely. Absolutely.
So is there a possibility that I can fix body alignment myself, as in, for people who are not in your city? So is it possible that we can do something like that?
Like I told you that a lot of things, a lot of movements can actually not done, in a natural manner, or it is not possible. But yes, what we do is I have a list of my exercises on my YouTube channel where I keep
Okay.
guiding all my patients that at least start exercising this way, at least start moving your body in this manner, at least do the basic stretches, whether it is for your neck or your back or your knee. And I think things can get better. And whenever it is possible for them to see me, we can further do alignment and make things more better.
Okay. So can you give us two maybe posture alignment tips?
Sorry,
What would be
I missed out on this one.
two? Yeah,
I'm not
two
able to
posture
hear you.
alignment tips. Can you hear me?
Yes. So,
I'm
talking about
talking about
postural
two
alignment,
posture alignment tips. Yeah,
yeah,
which
yeah.
which are the tips which you generally see is wrong with most people and which would be
Yeah.
corrected.
So, like you said that today we are doing work from home, and most of the people are actually having screen right in front of them, and they're just trying to adjust their work accordingly. So now, for example, let's take up this position itself. When we are doing an interview here, we are on screen and we are trying to do that. So here, when we are trying to do a forward head, we are coming ahead and we are trying to do this. Unknowingly, we are creating a bad posture here. Okay, so instead
Okay.
of we going forward, what we could do is we can actually get the screen ahead. Okay, taking the screen ahead
Okay.
and simply, resting back on the chair. Now you can see my neck is absolutely straight. Even when I have to talk to
Correct.
you, I don't have to really kind of, come forward and create this forward bending. Because for
Right.
me, let's say this meeting may just continue for another 10 minutes, but people who are working from home, they have to work for 8 to 10 hours. And if you imagine a football on your head,
Correct.
how would you keep that football? It would be exactly right in the center. It cannot go forward, it cannot go backward, right? The moment it comes forward, you
Absolutely.
feel the pressure is more and the football will fall. The same thing happens with
Fall.
your neck. When it goes forward, you have an immense amount of pressure on your neck muscles. And then by the end of the day, you start feeling pain in the neck. You feel that your trapezius muscles are a little tight. So I think one important thing is that always rest on your chair and adjust the gadget. Adjust the screen, check
Hmm.
your laptop screen. Your laptop screen should always be at a 0 degree or maybe
Hmm.
plus or minus 15 degrees. It should not be at an
Hmm.
angle where you have to actually bend your neck or even look up. None of the movement should happen. It should be just neutral to your eyesight. So
Stay
the
up
moment you
straight. Yeah.
have that exact, yes, the moment you have it exactly in front of you, you don't have to move your neck a lot. And yes, having said that, though you are keeping a good posture, the best posture is the next posture, always. So it's very important that you keep moving, you keep, easing out your muscles. So let's say if you've taken a break for, if you have worked for about 40-45 minutes now, it's time that you just get up, move around, and probably just come down after 2-3 minutes, and then come back and take your seat. Okay. So it's not like a huge 15 minutes break, but yes, even if 2-3
Okay.
minutes, you're actually cutting down the whole co-contraction of your neck muscles and excessive firing that is happening by your posture muscles, and giving them a break by taking that 2 or 3 minutes break, and it really helps.
Hmm.
Yeah, so these are the two things that you can do. Take frequent breaks, at the same time stick to your chair, don't try to come forward all the time.
Okay. So with your spine straight and stick to the chair, don't move forward.
Yes,
And the other uh,
yes,
one you said is that taking a short breaks in between if we are having long
yes,
hours at work.
absolutely,
Right. Thank you
absolutely,
so much for
absolutely.
this. Now, if we can, I'll just take quickly a small rapid fire, so that with in 2 minutes or 1.5 minutes, we can answer some of the questions which I can see on my screen, which people are asking.
Okay,
One thing
sure.
which is common in most clients,
Bad posture.
good one, yeah. Most difficult thing to make patients understand, one thing which you find it very difficult to make patients understand.
Exercise is important.
Yeah, is it that difficult? Because today, like,
Yes,
people are,
absolutely. See, the exercise for people means gym, or exercise for people means heavy workouts and things like that. They fail to understand that even moving around, maintaining your mobility is also a good exercise. And all you need to do is keep moving around instead of staying still.
oh wow. Uh, One suggestion which you give to most of your clients.
Take care of your posture.
Please come again. I missed it.
Take care of your posture.
Okay. Okay. So after this chat, I'm definitely, I'm going to be super conscious about the posture. One idea that can change people's life.
They should really look at the way they walk and stand. 99% of the people don't walk in the right way, they don't stand in the right way. And in my body alignment sessions, I just don't do body alignment, but also tell them about these things and tell them how they can correct it.
Okay. So other one more question is that my profession is quite easy, or it needs quite a bit of expertise. It's about your profession. I'm asking you.
It needs a quite a bit of expertise because I have to subjectively understand every human body, though the whole system is the same, but the changes that they're showing is very, very different. So I have to understand and accordingly change it.
Absolutely. One thing which most people do, but they shouldn't do.
One thing that
Most
I couldn't
people
hear you.
do, okay. One thing that most people do, but they shouldn't do.
Eat a lot.
Okay. So you're saying mobile, you should be mobile, you should exercise, eat less. So all the no-nos to what people mostly do.
See, most of the
Last,
time
yeah,
we look at complicated solutions. We always want complicated solutions. If I'm not able to offer you a complicated solutions, you could probably question my expertise. But
right,
most of the time,
right.
but most of the time, the solutions are
Yeah,
simple. It's all about how can we
absolutely.
adapt it. I could give you the same tip in my consultation and charge you a bomb. Okay, but I'm sharing this on an interview. I'm telling you absolutely what needs to be done. And trust me, if you follow this, there are people who just tell me that, we are just watching your videos and we follow what you're telling, and it has already started giving us results. And I'm very happy about it. So I think
Right.
it's not just about people who come to my clinic, But yes, if they really want to do it, it is within them. It's not me who's doing it.
Last one, most difficult client you have ever met. Tell us
I
something
wouldn't say
about your most
difficult.
difficult client.
Yeah,
Yeah.
I mean, I wouldn't really say difficult, but recently I met with a client who had an issue with her
Weird, is
back.
it?
Uh, yeah, in my Thane center, and what I could see is she was just 25 years old, and she had a severe back pain, and doctors already told her that you should undergo a surgery. And she was walking in such a bad state, you know. I felt sorry for her more than difficult. I failed to understand that what exactly happened that made her walk in this manner. She was almost walking like a polio patient, where she was actually not having polio. But the problem is that she was just trying to compensate her pain in some or the other way. And
Right.
it is only
Right.
15 days, it is only since 15 days that she was walking like that. Before that, her walk was
Okay.
absolutely normal. So I wouldn't say
Okay.
difficult, but yes, after the session, and even now we are treating her actually. So she's much, much better. Her walking stance has improved. But what I feel is more than being difficult, it is a lack of awareness that people have. The thought process of giving up on their body, or feeling that, oh my God, since I have contracted this, now I have to suffer in this manner. This giving up has to come out. We just have to stop giving up on our body, because human body is very complex, and it has an ability to heal on itself. All we need is the right
Right.
kind of guidance and a natural way of healing. If we can try to work on that, it will certainly make a lot of difference.
Yeah, Dr. Sudarshan, you have been touching lives of like thousands of people, and no wonder, people are getting healed, people, and shows because so many people are following you, so many people are getting your treatments done. So it itself is an example. But for me, there's one thing which I've really been inspired, knowing you and following you, you know, is your enthusiasm for fitness. And yes, one more thing which I want to add here is that yes, what Dr. Sudarshan rightly said, that sometimes the solutions are very simple and we make it complicated. And till the time doctor doesn't tell us these are the steroids or these are the medicines which we need to take, we think, oh, this is not a valuable
Small
suggestion or
thing.
something. So but yeah, this is a very small thing. So sometimes it's really, really, I want to show a small video to my all the viewers so that they. So that was a
Thank you.
wonderful headstand, Dr. Sudarshan. So
Thank you.
and not this is only one which I could show on the show, but I've seen so many of them, and you are really wonderful at it. It's great. So
So I
the
think this is
reason
just
why
a,
I'm
yeah.
yeah, please go ahead.
So this is basically just it's my own quest where I want to achieve something like this, and I don't say that I recommend that everybody should do a handstand, but I always feel that we should always realize that human body has a lot of potential, and you can do a lot of things, and if it anyways inspires or even a few people, I'm glad that it can be done. And more importantly, my job is about talking about exercise. My job is to motivate people to move. And if I am not in a position to move, or if I am not close to
Right.
fitness, that's a wrong statement, that I would ever make for
Yeah,
a
that
patient. So I
defeats
don't
the
want them
purpose
to follow.
basically. Yeah.
Yes,
Right.
absolutely. So I would not want my
Yes.
patients to feel that way. So that's something which I feel every physiotherapist should do, where every physiotherapist I feel should be fit enough, and only then in a position to guide their patients for exercises.
So that's like absolutely leading by example. And the
Yeah.
reason, why I have showed this small video clip on the show is that people should understand that what he's saying is not just saying it. he is also practicing it, and it is very important. All of us should have mobility, correct postures for us to have a fit and great and healthy body. One question which someone has been popping up for quite some time. Only last question I'm going to take, and then we're going to close it.
Yeah,
That if someone
sure.
walks like a duck, they are
Sorry?
saying that if they're not walking straight, but if someone is not walking with their toes straight, but at an
Yeah.
angle like this,
Yes.
how is it a possibility that that can be corrected, and
Yes, it
how
can be
is the
corrected.
question?
Yes, it can be corrected. Basically, this problem is not to do with the legs really. What happens when you start walking like this way is you're doing
Yeah,
actually you're rotating your hips, you're rotating your hips. And what happens is in order to accommodate this hip portion of yours, your pelvis also has to start rotating. And once the pelvis starts rotating, the foundation, your pelvis is the foundation for your spine, on which your whole body is standing. So that foundation somewhere starts changing, and that starts giving body change. So it's not coming from your foot, it's coming from your back, it's coming from your pelvis. Okay, and that is where people most of the time, either if they're obese, you will see that they will always keep their legs outside. That's because they cannot
right.
accommodate their legs straight. So that again starts creating a vicious cycle where they will have a bad back or a bad spine. It can very well be corrected if you are following some corrective exercises for the back. At the same time, if you can do a body alignment and if you can maintain your body weight, because if you have a huge amount of weight, it is very difficult to have a straight gait or probably even try to walk or run in the right form. So it has all to do with this.
Okay, okay. So thank you
Right.
so much, Dr. Sudarshan, for being on the show. It was a
Thank you, Dr.
great
Vandana.
afternoon. Yeah, and we had the privilege of knowing so many things. Thank you so much for being on the show.
Thank you, Dr. Vandana, for inviting me. Thank you so much.
Thank you.
Thank you. Take care.
Take care.